Okay, I want to welcome. Thank you. I want to welcome everybody. My name is Rocky Signs, and we are currently representing the Michigan Radiology Society, which is the state chapter for ACR. And this is the student section, which was just created a few years ago. It was created by Danny Ma. Those of you who know him locally as a radiologist, was prior president. It was his idea, and every year we've been doing new things for the students. So our main focus is to try to educate medical students on what radiology has to offer them as a career, and then try to help them with that, to see special things that we can do with them and for them. And what I mean, just briefly, besides today, which is a thought of our medical students from 2 years ago in the group, and this is our second year doing this Q&A, is in the last 2 years, and this year we'll do the third year, as we've done a yearly symposium where the students present cases. So, and last year, to give you guys an idea, there was 40 cases presented, and we picked 7 of those as winners, and they presented it. So it allows them to kind of buff their CV and also present to, we did a virtual meeting, but present to multiple people and present to the MRS at a state level. So this is just, so for all the students on, I want to welcome all of you. Thank you. We're really doing this for you guys. Again, this was something that was thought of a couple of years ago, and this is only our second year doing it, but to have a Q&A where we have all of our local PDs and all the ones that were able to make it tonight, some that are not here represented or on vacation or working or doing something like that. But here's a list of the PDs that hopefully all have made it. I've seen most of these physicians on tonight as we're waiting to start the program. So our main idea tonight, or how we're going to run this, is so Dr. Kate Klein is my co-chair. She's on the call as well. And between both of us, we'll mediate and we'll read the questions. So students, you have 2 things you can do. One is you can type a question into the chat, or 2 is you can just raise your hand and you can verbally say a question if you'd like to do it that way. So either way, however you want to do it. So we've started off with a question. I'm going to turn it over now to Dr. Klein.
Hi, everybody. Thank you for coming, especially the program directors during this busy time. Very much appreciated. We understand the timing of this is a little bit unusual, given that it's sort of after, you've probably already created your interview lists. But I think one question I have, and maybe the students do too, because there's been so many different changes. So with all the changes with signaling and regional preferences, how has this change affected your initial and final selection process, if it's changed at all? So I think we can go around, and I could start just with the list, but Dr. Griffin?
Yeah, so I'm Brent Griffith, Diagnostic Radiology Program Director at Henry Ford Hospital. And I can say that for our program, for the initial selection process, signals play a pretty big role. Obviously, when we're looking at applicants, we get, I think it was, between 950 and 1,000 applications. And obviously, you're looking for applicants who are interested in coming to your program. So we definitely put a fairly big emphasis on signaling when it comes to initial selection of people to interview. When it comes to once they've been selected to interview, signals kind of go away. Our interviewers don't know who signaled the program. It's not involved in the ranking process at all, just in that initial selection process, so that we can kind of hone down our review of applications to try to give more of a holistic review to those applications that we are reviewing. And then the same thing with geographic preference, although I would say signals carry more weight.
Thank you. I'm just going down the list, which is in alphabetical order, so there's no specific reason I'm picking on people. So Dr. Massa from Henry Ford.
Hi, yeah, the IRDR program director for Henry Ford. Very similar process what Dr. Grove described. The signals are really useful in deciding interview invites, and after that, they pretty much fall away. Geographical preference is helpful, maybe kind of treated as a soft signal, but the true signals are more useful. For me personally, the gold and silver has not been, since there's so few of them, and I know, especially for our program with IRDR, they have to be split between both IR programs and DR programs, that for our program, really a signal has been a signal. Not too much weight has been placed on gold versus silver, but I think that has to do with size of program and things like that.
Thank you. Dr. McKnight from Beaumont.
Yes, I'm Tim McKnight. I'm the program director for the Beaumont Farmington Hills program. So I agree. I echo what Dr. Massa said. As far as for the initial screening process, that's how we're really viewing signaling right now. We aren't putting any emphasis really between the gold and silver levels, and we haven't really changed how we approach things with the regional preferences at all. So as this is still pretty new, we're still trying to navigate, how best to use this new tool.
Thank you, Dr. Jim Morrison.
Yeah, hi, thanks. And hopefully you can hear me. Pretty much the same as what's already been said. I think the gold and silver signals are helpful to, whittle down those folks who are most interested in the program. And I don't find the regional, because I know that, or I just learned that, medical students can select several regions and put different reasons in there. So I think that plays less of a role in our selection process. Thanks.
Thanks. Dr. Pappas?
Yeah, I'm George Pappas. I'm the DR program director at Trinity Health Oakland. And same as everybody's been saying, the Signal program has been very helpful for us to make our initial whittle down from the hundreds of applications we received to help us with who we're going to focus on to interview. We're a smaller program, so those the signals really help us to identify those who are familiar with us and truly interested in our program. So it's been very helpful.
Thank you. Dr. Purushottam?
Hi. So yeah, like everybody said, the signals do help us in whittling down the list for the interview candidates. The regional preferences are also kind of interesting. They, when the students are able to explain their lack of regional preference, that kind of throws a light on their individual choices and the thought process behind it. So that also helps us to figure out what would be a better candidate, or are they truly serious about applying, or it's just one of those things that they did, in a huff. So it does help. It's very helpful. I'll say that. Yeah.
Thanks. Dr. Bill Shirk from U of M.
Wait, I want to break in real quick. You
Sure.
skipped Dr. Pizzali.
Oh, I'm sorry. Dr. Pizziali?
You're muted, doctor.
Thank you. Yeah, thanks for getting back to me. No problem. So Dr. Pizziali from Beaumont Royal Oak. I agree with what everyone else has said so far. It's a great way to just start screening that massive list of applications that we're all getting nowadays and get you to the right people right off the bat. But by no means is that the only people I'm interviewing. I'm certainly looking beyond that as well. But it's just a good starting point. And division signal is a kind of a helpful secondary point. And like I think Brent said at the beginning, once you're in the pool, then that signal kind of goes away. It doesn't really matter after that point.
Thank you. Okay, try it again. Bill Shirk.
Thanks, Kate. I think this is a hard question. And this is I was hoping for a softball question to start out with, because I think, from a med student perspective, I think there's probably a lot of advice that's shared about what to do with the signaling. So from our end, just like interpreting what a medical student is thinking when they signal a program, I think is hard at this stage when it's so early. So I guess my advice, I totally agree. I think from like a screening tool with the initial application in the pool of like amazing candidates that are out there, it helps just kind of, give you that leg up in terms of like another factor that goes into being selected for interview. And beyond that, it's kind of a holistic review, as was said before. That being said, there's other ways to show interest in programs that are, not just gold and silver signaling. So I guess I would encourage med students that are out there to, reach out to the program director, reach out to the selection committee, and you can show interest in other ways too, doing away rotations, whatever it might be. So, aside from this like novel tool that's being used, and we're still trying to suss out what is the actual pathway forward, and we don't even have any like good data to support like kind of how things kind of roll out from when people signal certain programs. I think showing interest in other ways is still important.
Thank you, Bill. Dr. Kara Udiger.
Yeah, hey everybody. I'm Kara from U of M in the DR program, and I too agree with what's been said so far. I think a couple of things to point out. that are a little different. One is we, on the DR side, we bring in the signaling and the geographic preferences pretty late in the interview selection process. This is really just kind of like a last minute glance at how to tell who might be interested regionally. I think we try our best not really to look at this at all. We like to think that we're kind of looking at the pool of applicants and judging based on other things, and not just what the signals are. So it has kind of a minimal importance for us in the selection process. The other thing I would just advise you guys is to just to signal what you truly want to signal. I think I've heard here and there talk of like gamesmanship with this, and I would just avoid that. I would signal who you want to signal. And we as a program, and I'm sure all these other programs here, realize that like you may not know going into the interview process what you want at the end of the interview process. And we totally get that. And you guys have a lot on your plates trying to decide all this. So I would just go with what your gut tells you. And you know, I think we'll all give you the benefit of the doubt with that.
Thank you. And one of our former residents, Dr. Andrew Woodrow.
Okay, how's it going? Yeah, I think that a lot of good points have been made here. The signals, we don't really know, as Kara was saying, we don't know, or maybe it was Bill that was saying it, we don't really know how this is going to shake out in the long term, right? Because we don't even have all the data of, like, let's say, ask all these programs, how many people did you match last year who signaled you, right? And how many people did you match that didn't signal you? And that's only 1 year of data, and we had only 6 signals, and now we have 12, and things are just on this changing roller coaster, right? For you guys and for us and everybody. But I will tell you that being on the West Side, being the only residency program that's not sort of centered in the Detroit area, I think it's super helpful. And I'm a softie, so it helps my heart. Like, I used to like look these 950 applications and think, oh, what if I miss somebody who really wants to be over in Grand Rapids? And now I don't feel that way. So that's selfishly, I don't feel like I'm gonna like miss somebody who really, really wants to be there.
Thanks, and thanks everybody for introducing yourselves as well. Do we have any questions from the students yet? I don't see any in the chat. Hello, I was wondering if you all could please discuss the role that audition rotations play and how they're weighed. Thank you. This is from Spencer Gilbert. I was just going to let you guys free for all at this point.
Well, I can comment on for diagnostic radiology at Henry Ford. I think there's a big difference between diagnostic and interventional, but I'll defer to the interventional program directors for that. But for diagnostic radiology, it doesn't really make much of an impact at all. I mean, you can meet the program director if you can, but it really doesn't make a big difference, at least at our program for DR.
I wasn't very sure what an audition rotation means. Is that a clerkship, or is that just meeting the program director and going around the department?
It's an away rotation.
Okay. So for interventional, I'm from Beaumont. I'm the APD for IRDR. For interventional radiology, it does make a difference. We like to see how the particular candidate functions, you know, in a busy department with all kinds of personalities around him, how their hands move, how their minds work. It is a very good insight into their mindset. And for us, because we are centered on active patient care, you know, like literally hands-on. So we need to see that personal side of the candidate in more depth, because we would rather have somebody who is good with patients, good with their hands, rather than somebody who is super intelligent, but a little, you know, difficult to get along with, right? That makes a huge difference in IR. It's all teamwork. Thank you.
Thanks. Would anybody else like to add?
Yeah, I would say it's helpful, you know, as people have said, it gives us all a chance, both the staff and the residents in our program, a chance to get to know the person and see how they may fit in. but by no means is it something that is absolutely necessary for you to be considered for our program.
Yeah, I can speak on behalf of IR at Henry Ford. Certainly helpful, definitely a great way for us to get to know you and you get to know us. Not necessary at all to get an interview or match. But it, just potentially is a way. I think honestly, it's really more for the med student to actually experience a place, see the chaos that can be the day-to-day that maybe doesn't come through an interview, and really get to see if this is where I want to spend potentially 6 years. So it's a little bit less about like, oh, I got to do an away if I'm going to even have a shot or something like that. It's more, I think, a chance for the med student to truly experience a place that isn't their home institution. So I think it's just as much about us getting to know you as it is about you getting to know us. Yeah.
Thank you. Jim, I saw you unmute yourself.
Oh yeah, thanks. So I mean, my advice to the medical students is always that well, for one, it's not necessary. It's a double-edged sword, because if you're spending 2 or 4 weeks with an away rotation in a department, I mean, that's a month-long interview. So you have to be at the top of your game for that whole month. Now, if you're dead set on matching at a particular program in a particular place that's kind of outside of your home region, it can be very helpful. And I've seen it be very helpful, for that purpose. But we've also seen it go both ways for us. We get a fair amount of outside rotators in the department, and some people come in and they wow us, and we think, well, that's great, and they might, move up on our rank list. And we've had the opposite experience where we've had people that we interviewed, they interviewed very well, and then they came and did on-site rotation, and actually it worked against them considerably. So I would say be careful. If you're considering doing that, it's by no means necessary, do I think, for matching at a place. But I do think the scenario that I can envision that it's most helpful with is, for instance, we had a medical student with us a few years ago who was engaged, really wanted to move to the Pacific Northwest. Her fiance's family was out there. She interviewed it. She did an away rotation, was very successful there, which wasn't surprising by any means. But I think that's probably a big reason why that department, ranked her at the top of their list. So that's kind of how I tell our medical students that you certainly don't need to do it. I think a lot of them come to me and say, well, we were told that we got to do, 2 or 3 away rotations. And I just don't think that's true. I don't know why that would be true. So thanks.
Thanks. George, I see you're unmuted. Dr. Pappas?
Oh, I'm good. I already spoke.
Oh.
I just wanted to add one thing, that there are lots of medical institutions that don't have exposure to IR. And for them, a little exposure to IR in the form of a clerkship is quite valuable. It's also just like, it's already been said, it's for them to observe the inner workings of interventional radiology also. It's not just about us observing them. We've had students from far and wide, down to Virginia, Kansas, and they come in search of plain exposure, just to see what is it in IR that is so critical that they should be able to see it. So they come by, they observe, and some of them move towards IR and some of them move away. But we don't make a special effort to sway them this way or that way. It is their own feeling and their own exposure and experience that makes it happen. Right?
Thank you.
Yeah.
How about somebody from U of M?
I guess, yeah, I definitely piggyback some of the comments were made. I very much agree with the earlier comment about with IR specifically. So much of the away rotation process is about kind of exposing yourself to different ways that a division or a department might run, and really, radiology is still a relatively small world, and IR in particular is a small world. So you're meeting people that at that next stage that might have had a positive interaction with you. So it may not be for residency, but it may be for a job or whatever in the future. I do think that there is you have to have kind of a self-awareness of how you might be in that 4-week period. So by that, I mean, I think that certain med students kind of thrive in that situation where they can just jump right into a external rotation. It's a new place, like they can hit the ground running right away. And it doesn't mean that if you can't do that, you're going to be a bad resident, but it may just be more difficult to kind of show your skills and your abilities in that 2 to 4 week time period. So I think you have to kind of reflect upon your own skill set as a medical student and say like, hey, am I going to be able to go to this place and thrive in this relatively finite time period?
Thanks, Bill. Kara, any thoughts?
I agree completely. I think this may be more stressful for medical students nowadays when the interviews are all virtual. I think this has become almost, I want to say, like more of a competitive thing sometimes to get a rotation. I think there's I don't know about other departments, but for us, certainly, like we just don't have enough space to have all of the external rotators who want to come. And I think that that's difficult to navigate. And it may put more pressure on a student to feel like I really need to get a rotation somewhere because otherwise I won't be able to see this place. And I think that that's been tricky. I think that's what we used to like about having in-person interviews was the ability to show everybody a little taste of the department. And now it's sort of like either you have a 4-week rotation or you have nothing, which is interesting. So I would not put pressure on yourselves to do this. If, like Bill said, you don't feel like you perform well in that situation, I think that's good self-awareness. Or if you just can't make it happen logistically or for personal reasons, everybody understands that. I think if you do it, I would view it as a great opportunity to see the field and to see another place and try to do your best with it. And it's a great thing to do if you can, but if you can't, I don't think it's not, we understand that. So.
Thanks. And Nina, I am going to get back to your question. I'm just going to jump to one since it seems to be sort of in line with the other questions, but how do you evaluate an applicant who is applying to both IR and DR at your program? Kara, do you want to kick us off?
Sure. I was going to say I have some thoughts on this. I think that's viewed positively. I think that what Bill and I share the residents at U of M, and I always think that for a lot of the beginning of residency, 3/4 of the residency, like they are in the DR group. Essentially, we're one family for quite a while until there's a little bit of subspecialization, and even then, there's a decent amount of overlap. And so I think you are kind of matching into one group, and to feel like you are equally interested or at least interested enough to be considering DR if you're going into IR. I think that that's great. I think that DR is a huge part of IR, and to show that enthusiasm, I think is viewed as a real positive.
Yeah, I'll piggyback on that and totally agree. I mean, at U of M, we're looking for like 11 great radiology residents, and like the demarcator of IR and DR is less important, until eventually they get into their future careers. But one of my main factors in evaluating candidates is the thumbs up or thumbs down from Kara. And even if you're applying to IR and you're not applying to DR, it's still very important to have that input from DR, because that is going to be such a heavy part of your residency, your training, and the fact that you're going to be doing image guided procedures.
Yeah. Henry Ford, I would say the same. I mean, I would echo the same thing. And we have a very close relationship between the IR and the DR programs. And so we actually interviewed the applicants on the same day. You come and interview for the IR DR and you interview for the DR program. So it's definitely not negatively viewed.
Anybody else want to comment? Somebody's got a nice question here. What qualities do you seek in a medical student application to merit an interview invitation?
There are no softballs today, right? I think all these are good questions. As Bill was saying, I was hoping we'd get a softball, but I think this is the eternal question, right? That the med students always want to know, and that they're always asking the program directors. And I don't think there is one answer to that. And I don't think there should be one answer, right? I don't want to see X board score or X, activities, or somebody who worked on the Mars rover project. I did have an applicant once that did work on the Mars rover project. But it's kind of this, I hate the buzzword, the holistic review, but it really is. It really is. You're just gonna go back to it. It's the whole sort of package. And if you know that you have deficiencies somewhere in your application, that's okay. That's okay, right? You can certainly make up for it with strong other areas of your application. So if you're extraordinarily strong in one area, that makes up for a lot, I think. So there's a lot of areas now. With don't get me started with ERAS. There's a lot of areas.
Thanks, Drew. I'll move on to another question. That is a tough question. Sorry about that. Sorry about the no softballs. Post interview, what are some ways that you appreciate students showing a strong interest in a particular program? I know we talk about the love letters, we talk about the thank you notes, but is there anything that can really tee you off to show genuine interest in your program?
I know some students do come by for a second look, but that second look is conducted by the residents, and the attendings have absolutely no, what should I say, participation in that process. So it really does not improve any prospects, but it does give the candidate a good insight when they are making a list, when they are ranking a program. They can make changes to their list according to the second look impression. But other than that, I am not aware of any particular move that they can make to improve their evaluation post-interview.
Yeah, and I would say that, some people send emails, thank you emails after the fact. I mean, I appreciate them, but it doesn't really make a difference to me. And then, we're going to be planning on having second looks, but that does not impact, like was just said, that doesn't impact their ranking at all. Our rank list is done prior to that, and the program directors and the leadership is not involved in that at all. So.
Thanks. Dr. Pappas, do you have any thoughts?
Yeah, just really kind of the same thing. The little thank you notes, the emails, those are nice to receive. It shows that there's some genuine interest there. And we also offer second looks, but as everyone else has been saying, those are really conducted by the residents, and it's really for the applicants to gain some insight into our program and our department, and it's really more for them than for us.
Thanks. What advice would you give a third-year student on how to go about showing interest in programs besides signaling?
This is where the clerkships come into action.
Mm-hmm.
They give a chance to the candidate to be at a program, to show their interest, and to be able to meet with the attendings, other than the residents. Obviously you work hand in hand with the residents, but you meet the attendings, you express your desire, and this is your chance to rake up something that could go onto your CV. So, but at the beginning of third year, that is exactly the time when you should start making those moves, and not wait too long till the beginning of fourth year, because sometimes, like somebody already mentioned, the clerkships get clogged up too, and it's hard to get in on the clerkships. Yeah.
Any other thoughts?
Yeah, I was gonna say, just for third years, obviously, most of them won't be able to get rotations. That's usually an M4 thing. Some schools will let radiology rotations happen in the M3 year, but you can always reach out, to the residency. You reach out to my chief residents or chief resident of another program and see other opportunities for us to come and spend a day or spend a day or two, just on the side if they have time off from other rotations that they're doing, even if it's after hours, come and visit. And just reach out to chief residents, see if there's ways they can get involved with any projects that are going on with residents and be involved with that. So that's the best thing you can do, I think.
Yeah, I was going to mention the same thing, is that, you may not be able to do a rotation there, but if you can reach out to the program and get on a small project, a case in point, a case report, something like that, I think that helps show some interest. Otherwise, there's not a lot of great ways to be able to show your interest. So.
Yeah, I'm always impressed with how open the program directors are in meeting the students from all different schools and areas in all different years. So, okay, this is not a softball, Andrew, but I think it's a really interesting question from Nina. She said, I've seen a couple of articles published this year about creating psychological safety in radiology residency programs, and that it's a new ACGME requirement. Could you give us some insight into discussions that may be going on internally to cultivate that? And what, as applicants, should we be looking for in programs to gain insight into that culture? Kara or Bill, would you guys be willing to lead off this one?
This is a great question, Nina. Kara, do you want to start?
Sure. I think this is super important. I think one of the things we talk about a lot in our program is that we care about our residents first as people and not just as radiologists in training. And I think that when you're talking about psychological safety, which is a better term, I guess, than anything I could come up with, but feeling like you're in a comfortable environment where you're included and feel like you can express opinions and all of those things. I think that has to deal with, I think, the culture of the program and the supportiveness of the people that are around you. And I think that's something that we have talked about a lot in our program all the time, because we're dealing with not just radiologists in training, but 44 people. And I think that is, I'm sure, is the same for all these other program directors and APDs on this call. This is why we do this, because we care about you guys as people. And I think what you'd be looking for in a program is like that culture and that vibe. And I think you get that from listening to residents and asking residents questions about how they feel about their work environment and how they feel about their interactions with faculty and with staff and with each other and then with the program administration. And do they feel like they're listened to? Do they feel like they can say what they think? Do they feel like people care about them? That's what I would try to get into. And I think that can be tough to do in a virtual setting, but you do your best. Talk to as many people as you can. And I think that is something that all of these programs really care about and work on. And I think it's a tough question to ask probably in an interview, but you do your best by trying to assess just what that vibe is and how do people feel about the interactions around them. I don't know, Bill, if you probably have a better way of saying it than I do.
No, I totally agree. I think so much about like this, the notion of psychological safety and this like residency position is about that kind of open dialogue and the ability to be kind of listened to as a person, as a trainee, as an employee of the system that you're working in. And so some of that is just that kind of like feel of the culture. So if you go in an interview scenario, it may be hard in that finite amount of time, but I think it's fair to like ask questions that relate to this. Like, what do you do if a resident has like a major life event in residency? Or do you have like an example of something that might happen? How does the program kind of adjust to that? Or even just like at a more kind of micro level, are things built into the curriculum that address some of these very important and relevant topics? So, are there discussions about burnout? Are there discussions about moral injury? Are there these discussions that like promote this idea in a very like granular level into the curriculum, or is there time allotted to kind of have these discussions, beyond just the culture, is it actually like an emphasis that the program puts to integrate it into the curriculum? And I think these are questions to ask in these like interview, or if you're like, you know, searching out a program even before the interview process, kind of how to assess whether psychological safety, whether these important kind of aspects of training are actually addressed at a curricular level.
Thank you, Bill and Kara. I'd love to hear from the other programs.
I mean, I would say that, you know, echo what Kara said, is that, you know, when I'm talking to applicants, you know, one of the things I emphasize is that, you know, we're a very collegial, very, you know, collaborative place, and that makes it a very supportive environment, I think, for training. And so it is that environment, and it's the people that you're working with. The other thing I'll say is when you're looking at programs, I mean, look at some of the, like Bill was saying, you know, do they give, you know, do they have a wellness committee? Do they have wellness conferences? Do they give days? Can you get days off if you need to go for a doctor's appointment and those kind of things? Like, do they care about you outside of just, you know, the work that you're coming to do? So there's small things that I think you can look for there.
Thanks. Drew, you unmuted yourself.
Yeah, and this is a great question. It's, you know, maybe it's an aphorism. I don't know if it's Teddy Roosevelt or whatever, but I've always heard like people don't care how much you know until they know how much you care, right? And like, and I don't know if that's an actual quote or not, but it's absolutely true. And I think the second part of Nina's question is really interesting to me, is what as applicants should we be looking for to figure that out? And I think this is a great question for residents. So most of us, I think maybe all of us, have residents in the interview process, right? And it's a great question to ask residents at programs, is like, did you ever know of a time when a resident had a really difficult event, and, you know, how were they supported in that? And you can of course ask all of us too, right? Because we have those examples, but I think it means maybe more coming from the resident's perspective. As we all know here, maybe all the students don't know, but all the PDs know, radiology is kind of a kinder, gentler world than some other specialties. And so I think this is maybe I think it's maybe a little bit less of a problem in radiology, but it's still something we need to look at, right? And there are two ways you can look at it too: the program and the institution. Because like Brent was saying, our institution has a lot of provisions put in place for this. In fact, you know, days off for doctors and things like that. So a lot of times the institution supports a lot of it too. So there's kind of two prongs to this. There's the residency support and there's the institutional support.
Thank you, Drew. Dr. McKnight, do you have any thoughts on this? Oh, Jim.
Yeah, I was just want to say I really agree with what Dr. Woodrow was saying as far as you know, resources available. I know that sometimes, at least talking with our residents and even some alumni, is, you know, the system has robust resources available that they developed over the last few years. But I think one of the challenges for us is to make sure that the residents and, you know, students know how to access those resources. So, you know, we go to a lot of meetings and we're made aware of them, but the residents, you know, kind of come and go through the programs and don't always know what's available to them, or they read it in an email and forget about it until they're in crisis. And then, you know, and then they're trying to navigate this. I know one thing that's been helpful for our program is we've always, as every new person's come into the program, assign them to a faculty mentor who's not just, you know, there to help them with, you know, identifying research and academics and all that other stuff, but really to be an advocate for that person, be somebody who gets to know that person very specifically as a person and what their specific needs, you know, their hopes and aspirations are, and really can focus on them throughout their time with us. And it's also a way for the residents to feel kind of supported, because sometimes, you know, wearing our program director hat, they may feel a little bit uncomfortable or professionally distanced from us just because we are in that authority position. So the mentors often provide kind of an in-between place where they can feel a little bit safer to talk with them. I think in the same way as making sure we leverage our program managers, which have been a great resources to a lot of our residents, will always want to talk to the program managers about things they may not want to come to us initially to, because they don't want to necessarily bother us, or they're not sure, if they should, or should they be asking somebody else at the system level for assistance. So things like that. But yeah, I think this is definitely is becoming more and more of an issue. And I know our residents have frequently asked us questions that I would have never asked as a resident, things that they're interested in exploring, or resources that they'd like, some assistance in getting access to.
Thank you. Jim Morrison, I see you're unmuted.
Yeah, thanks. I'm just going to piggyback off of a couple of the comments that Dr. Woodrow made, specifically about and what as applicants you can look for in a program. I mean, I think we've unfortunately lost a lot in the virtual interview process, that those kind of intangible things that you could see when you were on site. I mean, if you went to a program like when I interviewed, you could kind of tell almost immediately if you were in a place where the residents were happy. And in fact, that was a big part of my decision-making process is, I wanted to be at the program where the residents were all happy. They all came down to lunch. They were joking around. They were interacting with all the applicants. So I know that's not with the virtual interview process. It's not easy to get a handle on that sort of interaction. We have our residents run their own virtual mixers. So hopefully other programs are doing that. So at least you get an idea of what the resident culture is like. My residents are thankfully, excited to do those things. And then I'm also thankful that our institution is letting us go back to doing some in-person interviews. And, because one of the best parts about the interview process, at least back in my day, I hate to sound old, but was doing the pre-interview dinners and going to lunch on the interview days and taking the tour at the residency. You really get a feel for the residency program. So to whatever extent you can do that as an applicant, to go to the mixers and to try to interact with the residents, I think that's going to give you the best sense of, who is happiest with their program. And you can even ask them, why do they like their program? Do they like their program? And that's going to give you a good perspective. Thanks.
Thank you. I'd like to hear from Dr. Pizziali.
Yeah, I mean, at least here we obviously have a institutional wellness department through our GME office. We have a wellness officer, and I've contacted her and asked her to do wellness lectures for my residents. My program managers hold their own little wellness events with the residents every so often, just kind of will every now and then skip a lecture and have a little game session for residents to play together and have some fun together. So I'm trying to engage them and be involved with them. And then for me, I have an open door policy to help them out with whatever I can.
I'm very supportive of the euchre tournament. Never. So we probably have time for maybe just one wrap up comments or questions, but if you could give the medical students two pieces of advice, those that are going through the interview process right now, and those that are thinking about radiology. I'll start with that, Brent.
Yeah, I mean, I think for those that are thinking about radiology, it's a great specialty. It gives you a lot of, as you can see, it gives you a lot of kind of flexibility and variability, whether you want to be doing, procedures or diagnostics. It gives you a lot of good work-life balance. You can do kind of a broad spectrum of things. Don't be dissuaded by talk about AI taking over our jobs or anything like that. So it's a great time to get into radiology. And then for those that are in the interview process right now, I mean, I think just as Kara said, when it came to signaling, in the interviews, look at the programs that you want to be at. I would take advantage, if you can, of second looks if they're offered, because as we've talked about, going in and kind of getting a sense for that environment is very helpful. So.
Thank you. Dr. Mazza?
Yeah, so for people considering radiology, I would wholeheartedly endorse just pursue it. I think there's no better specialty when you start stacking up against the other possibilities. It's just hard to imagine a better place to be, and gives you tons of flexibility, and you're working with tons of specialties and get to use some of that general knowledge you've worked hard to gain in medical school. You don't have to narrow yourself too much right away. And then for those going through the process, hang in there. It's a long road. Try to take advantage of opportunities to learn more about programs. At this point, it's really finding where you think you'll be happiest for the 5 or 6 years you may be there. So talk to everybody, talk to residents, especially. They really have no reason to hide anything. And so they're your best resource to get a sense of what is the day-to-day like, what is the culture like, are they happy, that sort of thing. So really just do your best to talk to everybody, and I think that will help you out.
Thank you. Dr. McKnight?
Yeah, so just echoing what you've heard before, radiology is, I think, in all of our opinion, the best specialty, and a much needed specialty. If you look at kind of all the open jobs across the country, and everybody's needing more and more of us. As far as for interview, I think the best piece of advice is really just be yourself. Make sure you express in your interview process who you really are, what you're all about, what you're really interested in. And remember, it's as much you finding the right fit as it is for us to find the right fit. So, don't try to game the system, just be really open and honest. And that's how you're going to get connected with the best program for you.
Dr. Morrison?
Yeah, I missed is it why go into radiology? Was that the?
Oh yeah, like just to give the younger students advice about radiology, and then advice to the current students who are in the application process.
Yeah, I mean, so radiology is awesome. Interventional radiology is just a little bit better. No, I'm kidding. I love radiology. I love my job. It's got to be the right for the younger ones. You have to go into the department and experience it to know if it's right for you. And so I'm not sure the spread of medical students, but hopefully, if you're interested, it behooves you to get experience early. And we have all sorts of students coming into the department from every level, to either shadow when they're in their younger years or to do rotations in the later years. And I'm sure across all the institutions here, there's always plenty of opportunities to get involved with research. And so that's another way. And I've had I've had a few students who were interested in radiology and then eventually, decided later on that they were interested in a different specialty. That doesn't stop you from getting involved with projects and being successful there. So, if you're interested, you want to get experience early to make that decision, and because it is competitive, and I can tell you that pretty much everybody's coming in with a variety of research projects and things. So the earlier you can get a start on that, the better. And for the current applicant group, yeah, I mean it's cheesy, but I'll say the same thing that was just said: is be yourself. The virtual interview process is flawed for sure, but it offers advantages over having to fly around the country. But you get 20 minutes with somebody, over a Zoom. You're just feeling each other out. My advice would be make sure you're prepared, because I still have people occasionally where you say, okay, well, what questions do you have for me as program director? And they can't come up with anything. So, just make sure you're prepared for your, have some questions, have some things that can fill a dead space in the conversation if it's becoming a struggle. Because it's really, the interview is a screening process to make sure that you're going to fit with the program and to see if the program is somewhere that you want to be. And best of luck to all of you.
Thank you, Dr. Morrison. Dr. Pappas?
Yeah, I would say radiology is awesome, as we all believe. It's a great field. It's cutting edge. It's involved in every aspect of medicine. It's fun. It's interesting. So absolutely, if you have that interest, keep pursuing it. And as far as those in the interview process, have fun with it. Enjoy the interview. Don't be too nervous. Have a good, interesting conversation with us. I like to look into not just the academic record and start asking them about research and things like that, but I like to fish out some personal interests that the candidates may have, and I enjoy those conversations. I think that gives me a good insight into the person more than just what is on paper. So just don't be nervous with it. Have fun. Ask the questions that you want answered. Don't be afraid to ask questions, and just enjoy the process.
Thank you. Dr. Pizziali? Did we lose him?
Sorry about that. I always forget about the mute. I wish I did it somehow automatically. Yeah, I can say for younger students and M3s, one thing they could do to kind of help generate their own interest in the field a little bit more is visit. When you're on rotations, if you have time, obviously you got to make sure you do your duties on whatever rotation you're on. But if you're on surgery or medicine and you have time, go down the radiology department and ask to go over scans of the patients you're following. And that way you can kind of see how we read a scan, how we look at a CT, you can get a little bit of a insight of what we do. Certainly if there's residents there, you can, at least visit them and talk to them, get their opinion. So you can kind of get some early information through your M3 year. And then that can help maybe build you in. I mean, obviously maybe limited to just your home program. You can't necessarily do that everywhere you go, but take as many advantages as you can. If you go to different hospitals for different rotations, you can get a chance to experience different radiology departments. And yeah, once you're in that M4 period of interviewing, if you have chances to talk to the residents on the interview day, take advantage of that as much as you can. Have a set of questions ready for them, about their life as a resident, and reach out to them after the fact if you didn't get a chance to talk to many residents during the time.
Thank you. Dr. Purushottam?
There we go. Okay. So, like Dr. Pizziali said, one of the best ways to find out whether you're truly interested in radiology, DR or IR, is follow up. So when you're on the clinical services, try to follow up the scans, the procedures that your patients had, and try to get some insight as to how this particular piece of information or this particular procedure actually change the course of your patient's care. Because this will truly give you an insight into what radiology is all about and how it makes a difference. Now, I am from IR, so I would really like you to, just like Dr. Pizziali said, come down to IR and visit, follow your patient from surgery into the IR suite, hang out there, learn from us, exchange notes, and then make up your mind. That's for the people who are still in the pipeline. The ones who are still interviewing or have just finished their interviews, well, for the ones who still have any interviews to go, just relax, take a deep breath. It's all right. Everything is good. You must be bright and attentive when you do your interview. Don't be overly conscious of yourself. Don't worry about things. That worrying thing surely shows on your face, and that makes us think. Why is this gentleman or lady not happy with us? What have we done to make her unhappy so quickly? So that is there. And of course, come by and visit us, for second looks. You may not see us, but you'll see the residents and you'll get a lot of information from them. They will tell you exactly the way it is. Thank you.
Thank you so much. Bill?
Yeah, I love the earlier comments that I think Tim made first about just being honest in the process. If you're in the interview process right now, I think just being honest with yourself, what you're looking for in a program will serve you very well in just finding that right fit. And I know that word is a little bit nebulous, but I think it is so much about the interview process is finding that fit. For the M1s and M2s, the kind of earlier med students, I think the truth is that a lot of us that went into radiology eventually didn't really stumble upon it until later on in kind of the medical school experience. So don't worry if you haven't demonstrated this like long-term interest in radiology stemming back to like your high school years. like that's probably the minority of people that go into radiology still. It's, you know, whether it's because of scheduling conflicts or access or whatever it might be, you may not get to kind of fully engage in the world of radiology until later on in medical school. Don't worry about that. I think the important thing, just building in your kind of application or your future you know, just endeavors into radiology. It's about just showing kind of longitudinal interest in projects that you're passionate about. It's about showing kind of resilience and interesting life experiences and teamwork and all these other kind of holistic categories that are important, regardless really of the specialty you're going into, but in particular for what we look for. So thank you and good luck.
Thank you, Bill. Kara?
Yeah, hey, I think the rest of the program directors have said some really great things. I think my advice for the students who are thinking about the field of radiology is just, I think the potential to have such a huge impact on patients with every single study that you read is huge. And that's something I didn't really appreciate when I was applying, I think, is just how patient-centered this field is, and then how people-centered this field is. I think we are, you guys know we are consultants, but we work with people every single moment of the day, and that includes patients, but it includes each other as well. And that's not the reputation I think that we always have, especially early on in medical school where you're kind of figuring these fields out. I think I would look at the giant impact you can have in this field on patient care. And it's just endlessly rewarding and interesting. I think you can have such an amazing career in this field. And then for those who are applying right now, I think I totally agree with this sentiment of being yourself and finding the right fit, and not to be pessimistic. But the other thing I'll say is that I think keeping an open mind is really good. You may love a program that you didn't think you were going to love. And you may end up in a place that might be your number 2 choice or something like that. And I think all of you guys, the med students here who are applying, like, you guys are very talented people already, and you're going to do great wherever you end up. And I think the idea of having the open mind and just putting in the work wherever you go, like you have a ton of potential wherever you go to any of these programs. You can make a huge difference in any of these places. And it's what you guys put into it is what you get out of it. So I think no matter what, you're going to do great. You know, and I wish you the best of luck. Thanks for having this discussion. I think it's been hopefully really, really good for the rest of you also. I've learned a lot.
Thank you, Kara. And last but not least, Dr. Woodrow.
Yeah, for those that are considering radiology, check it out. Bring all your friends, right? I'll try to avoid the radiology puns, but expose yourself to it early and often. Right. It's the more time you spend there, the more you're going to know if it's a good fit for you. And that's for you. Like it's totally for you. I think the more happy you are in a given field, the more you're going to give all of your heart to it, and the more you're going to make a difference with your patient population. So the more you can kind of know what you're getting into. I know that's a tough proposition for a medical student to, you know the career in and out, but the more exposure you get to it, the better. And then, for the people that are applying, I mean, look at this group right on this call here. You're going to get great training. You're going to get great training in radiology. Radiologists are such a great bunch. Like George said, have fun on your interviews, go out, learn about the programs, give everywhere kind of a vibe check and what's going to fit with you. And I think it's been said multiple times, but I'm going to stress it. Rocky's putting it in the chat right now. Talk with the residents. Such a great idea. As much exposure as you can get to the program's residents is fantastic. Even graduates of the program, right? Graduates might even know better. They've been out, they're practicing, they know how well they were prepared. So thank you guys very much for coming out tonight.
Again, I just want to thank all of our program directors and APDs that made the time in this busy part of the year to come out and share your pearls and your wisdom with all of these students. Rocky, do you have any final?
No, I was going to just echo what you said. We appreciate all you guys' time. Couldn't do this without the PDs. So, that much appreciated. Thank you. And that was great. Everybody's comments are perfect. It's 7:30 exactly on my phone. So Excellent.
I run a tight meeting.
You do. Awesome. Well, thank you, everybody. Good luck with interviews, students, and PDs. Thank you so much.
Bye, everyone.
Take care, everybody.